Well, hello again this week, my darling audience. It's great for you to have joined me this week. I have a great topic to give to you this week. It's something I'm very excited to present to you because, I've always wondered what we can do to move the needle for birth and make birth better for people. And it's meant that I've always kept my mind and heart open to new ways of thinking about things. And that's a real gift because we're learning things all the time about birth and how we can do it better. And I came across internal pelvic release work, which potentially can make the second stage of labour, the pushing phase, a lot easier for the mother and can create space in the pelvis and, support for that baby's descent through the pelvis and into this wonderful world that we live in. So, I came across lovely Lo Mathias, and she is a fabulous woman. She's just a gem. And she has a clinic around this, which I'll get her to explain more about, where she supports women in this phase. And she has a beautiful, rich history that she brings to her work. So, welcome, Lo. Thank you, darling.
Awesome to be here, Tracy.
Now, tell us a bit about your history and how you got to be doing this work.
I was born in Canada and I had scientist parents. I knew from a super young age I wanted to be a scientist. So when the time came, I went to Vancouver. I studied marine biology and really fell in love with the environment and healthy ecosystems and kind of sustainability and holistic health.
Mm.
And I did fisheries for a few years and then kind of needed a sea change. I met my Aussie partner and moved to Australia and kind of left the fisheries world behind. And while I was in Australia, I started exploring permaculture, small scale agriculture. Um, Eventually, I realized that actually I really wanted to work with people, and
Mm.
working in a field was quite lonely. And so I decided, kind of looked at all the professions that I could choose, and midwifery stood out for me as this beautiful blend between the science and this kind of holistic, all these other modalities you can really bring into this rite of passage. And during the time I was exploring all this, I had been traveling back to Canada to be with my sisters while they had their three babies. And my two sisters witnessed me being born at home, and so they chose home birth for their babies. And so that really influenced the kind of midwife that I knew I wanted to be. They had midwives at their births. And so I sort of started on this midwifery journey. And when I first came to University of Canberra, I was talking to my director, Jenny Brown, and she said to me, you need to make the opportunities that you want in this degree. And I really took that to heart. So I spent a lot of time going to conferences, going to courses, really seeking that sort of traditional midwifery knowledge and skills and
Mm.
kind of placement with a home birth midwife. And I knew I wasn't going to get that information at university. And
Yeah, right.
so one of the courses that kind of changed the trajectory was this course called Making Space for Babies.
Mm.
Creative Ways of Making Space. That's what it was called. And it was by Fiona Hallinan and Jenny Blythe. And that's where I learned first about, how to respectfully and consciously touch a woman, how to use breath,
Mm.
how to use body work. And the last half a day of the last second part was internal work. And it was just this little taste. And I remember when I first experienced it on my own body and then practiced it with my partner, I thought, like, how is this the first time that I've heard about this? This is incredible knowledge. And I knew it was so important for birth work. So I went away from that course with just this little nugget. And at the time, I didn't have the kind of knowledge, the language for really knowing how to share it with women. But in the meantime, graduated. I worked at the Canberra Birth Center at North Canberra Hospital. Then I decided to work in Canada. So I did another year of study and worked there for 2 years in rural community, doing home birth and hospital birth. And again, I kind of had this nugget. I knew this information, but I didn't know how to share it.
Mm.
And so in 2022, I saw that Fiona and Jenny and their colleague Andrea were offering their first year mentorship program in internal work. And I immediately knew I had to do it. So I came back to Canada, to Canberra, and I joined up and started practicing the internal work skills with my women that I was working with at the birth center in Canberra. And I just fell in love with the pelvis. It
Mm.
was kind of, it just became more and more interesting and more dynamic. And so I started seeking out other teachers as well that are doing this work around the world, different people doing it in different ways, just to get as much information as I possibly could. And like this last year, I went to Guatemala, learned abdominal massage from some of the midwives and healers there. And so I've really tried to bring a lot of that modern and traditional knowledge into my skills when I work
Mm.
with women. But it just seems like this is such incredible, important wisdom
Yeah.
to share with women.
I I I really admire the trajectory that you've traveled with this, because I think sometimes when we stay too much in the scientific field, we tend to focus on those things that we can measure and we forget about the psychosocial, spiritual aspect of birth. And if you think about, through pretty much all cultures and all through history, we've always had these wise women supporting us through birth that know things and have developed skills, midwifery skills, that can support the process of birth, often heading off complexity at the gate, where they can create through their preparation rituals and through the way they support women through birth positioning and different things that can help the birth process. That a lot of that wise woman stuff has been lost through history. And I think people like you are going to recollect it again and start to put it in our toolkit, because birth is getting more complex and our intervention rates are increasing, and it's not actually improving outcomes ultimately for mothers and babies. We're getting higher levels of all sorts of things in that process. So this type of wisdom really speaks to me, Lo, and I'm so happy I've got you in talking about this, because I get very concerned about the sorts of injuries and things like that women are experiencing through the birth process. Now, our lifestyle has changed dramatically, and I think that's a big part of it. We're much more stagnant, we sit a lot, and all of that's going to influence our pelvis. Can you talk a little bit now about internal pelvic work, or a little bit about what it actually is?
Yeah. So it's a form of body work that connects to the soft tissues of the pelvis. So,
Mm-hmm.
um, women, we have this amazing portal into our bodies, into this deep pelvic space through the vagina.
Mm.
And when I say soft tissues, there's all these structures in there. There's organs, the bladder, the uterus, the rectum. There's all the abdominal organs, of course, that impact the pelvis. We're talking about fascia, so connective tissue that holds everything in this beautiful web and alignment. We've got ligaments, so supportive structures that help support the bones and the organs. And then we've also got the muscles. So I think a lot of what women might be familiar with in terms of an internal assessment at a physio um, is often focused on the muscles. And so there's all these other structures as well within the pelvic space. And so internal pelvic release really aims to speak gently to these tissues and really offers them an opportunity, the space and the time to have a sigh, to soften, to release tension if it wants to. We tend to have a lot of holding patterns in the pelvis, um, things from old injuries, from posture. Like you said, we don't really have a lot of those deep squatting positions that other cultures have, and we don't do a lot of the traditional body work that would have been done in traditional pregnancy care. So we have a lot of congestion in our pelvis, and so this work, really helps to release a lot of that tension, and that can have a big flow-on effect. So it's not just for birth, but when you have tension in those tissues, it can impact circulation. It can impact lymphatic drainage, swelling. It can impact hormonal flow, even the mobility of the organs themselves, which need to be able to move for their various functions.
Mm, that's fascinating. So when you work with women in your clinic, what are some of the key things that you like them to know about their pelvis?
Um, so when I talk to women in my clinic about birth prep and preparing the pelvis, um, I really like to start with anatomy because, as women, we generally don't really know what's going on with our own bodies. I mean, I
Mm,
think the science is even relatively new, so little research is done. So
yeah.
I find, the more you know and understand about your own body, that the more you can start building that connection. Again, not just for pregnancy, but for your whole life.
Mm,
And so we do talk through all the structures. We go through the anatomy, and also how babies navigate the pelvis. So we talk about how labor really is this dance. It's this waltz between baby, who's doing their little wiggling. They're neurologically primed to birth, and they are putting pressure on mom's tissues. They're asking for space where they need it, and they're asking mom's tissues to soften out of the way. To allow them to easily pass where they need to. And we can't lie to babies. Babies will find the space that's there. Oftentimes, when they get into really tricky positions, they're actually being super creative beings. They're trying to figure out how to navigate the space that's offered to them. So we talk about how babies navigate that space and which structures impact where babies are in the pelvis and different ways to support that. So that's a big part of the education. And then we often talk about breath because we both know how important breath is as a tool for awareness. And I really love to give women the opportunity to figure out how to bring breath into the pelvic space itself. So really how to bring awareness into the pelvic space and work with that laboring process. Because what tends to happen when you're feeling discomfort, when you're feeling contractions, is and when we're feeling pain anywhere in the body, we tend to um, contract away and then pull our attention away from it. And so, what the body does, of course, is it increases the sensation to get our attention. And
mm,
so, if we can find tools that really allow us to practice keeping our attention where we're feeling discomfort, we can actually bring a whole lot of softness and space and oxygen to that part of our body, which is exactly what labor is asking of the body. So we do some breath work and a few stretches that are actually really, really important for labor and birth, little structures that we don't talk about in birth prep generally, like the psoas muscle, which can really impact on babies positioning the abdomen and how much space there is in the belly for babies to grow and get into a good position. And the sacrum, the sacrum, this powerhouse of labor, which is this incredible part of the pelvis that has so much mobility and is yet connected to um, not just our parasympathetic nervous system so directly, but also to all the soft tissues in the pelvis. So it's really important to spend some time talking to the sacrum directly um, for birth prep. And then we also do external body work. So, most women never get their belly touched in pregnancy. And it's just
mm,
such a relief a lot of the time when people realize how beautiful it is to have a nice deep belly massage, because we forget that the uterus, as it's growing, it has this tight piece of fascia that is pulled tight over it to support it, called the broad ligament. And it's also a muscle itself. We know muscles get tight. And so
mm,
the muscle, uterine muscle, and the fascia really love to be touched and softened in order to create that space out the front of the body for this baby to grow.
mm.
We're all taught from as young as you can remember to suck in your belly, right?
Yeah.
Girls are always taught that you're not allowed to let your belly hang forward. And so
Mm.
pregnancy is this really beautiful opportunity to learn how to soften in the front of the body.
You're making me want a
Yeah.
belly massage. I
Tell you,
think
it's
I'd like one of
amazing.
those
Yeah.
with my post-menopausal body. I
Yes.
think I think we should all have this, people.
Abdominal massage is a beautiful thing. It
Yeah,
really is amazing. Yeah,
yeah, yeah. Beautiful.
absolutely.
So it sounds like you're doing a lot of education work. What's the actual release and the touch work? Tell us more about that.
Yeah, so the external work is kind of working on the fascia, working on the muscles,
Hmm.
hips, sacrum. And then when we do an internal work session, we really start with the perineum. So it's a slow and gentle process of going into the pelvic space through the vagina. And I really treat it like I'm an extension of that woman's own body. So it's very much a conversation
Mm.
because ultimately the goal is for her to start to build this connection with what's actually happening in her own pelvis.
Yeah.
And so there's lots of, how's this pressure? Do you want more? Do you want less? Do you want me to hold this structure? Do you want to move to another structure? And this really co exploration of her own internal
Mm.
space and spending time at the perineum first, allowing her to experience what it's like for her body to soften and be ready and receptive. It's a pretty interesting experience because the perineum's like the gatekeeper, right? And
Yes.
um, when you actually put a finger on the perineum and you wait, and that woman actually feels like she has space to soften and feel safe, it's like it just melts, and
Wow.
it's the vagina opens and invites you in. And so we wait for that to happen. And a woman can generally feel when that takes place.
Mm.
And then when the body's ready and she's ready, we go in. And most people are used to a vaginal exam where you put your fingers in and up. Everyone's looking for the cervix.
Yeah.
In general, it's all about the cervix. And we really go down. So we go down through the back wall of the vagina. And through that back wall, we can access all of these amazing structures. We can access the fascia. We can access a whole lot of muscles, other than the pelvic floor muscles, as well as them, and the ligaments. And we can speak to all of them and see where there might be tension or tenderness, and what might want to have release.
Mm. That's powerful. So that's a very intimate process, Lo. And you mentioned the word safety. And when women feel safe,
Mm-hmm.
then the structures melt. And I don't know, well, it's not always easy to feel safe in birth because we can have bright lights, we can have people coming in and out, we can have people talking to us in a way that can be confusing, can be confronting, and insensitive to us being in labour land. And so, really, what you're saying here is you're giving a woman the opportunity to find and connect with those sensations with direct feedback as you work your way into different parts for that mother to start to connect with. And I love the word conversation, how, to have a conversation with your own body through that sensory feedback.
Mm-hmm.
Um, it sounds like what you're doing is helping women to relax into that process. Is that the
Yeah.
yeah,
Well,
through
it
that
is.
safety?
Exactly. And I've had a woman describe it to me as a client describe it to me as like the closest thing she could imagine to practicing labor,
Yeah.
which is interesting because you can't practice contractions.
Mm.
But when you go internally and you start to explore some of the structures that hold tension, you often find uncomfortable sensation. So
Yeah.
that can be stinginess, it can be pressure, it can be achiness, it can be even
Mm.
emotional triggers, memories. Lots comes up when you touch these tissues.
Yeah.
And what this work asks for is, can you be really present with those sensations and practice how to soften into that intensity?
Mm.
So
Mm.
places of intensity you don't want to run away from in the pelvis because they're places you will meet in labor.
Yeah.
You can't run away from them, but you have this beautiful opportunity in pregnancy to befriend them in a way,
Mm.
get familiar with them, and learn the skill of being able to soften those tissues. And it's one thing to work with a care provider, but the real beauty comes when women do this work themselves
Yeah.
because they're building the neural connection themselves with a short daily practice to be able to, so their mind is saying softness. They learn how to feel that in their own pelvis and they use their biofeedback tools, their hands,
Mm.
to actually be able to feel it in their tissues, to be able to go and see the change that's happening throughout their pregnancy as they're doing this work. And it's such a rich time to be doing it because they've got relaxin on board.
Yeah.
And so their body is really primed for softening. And so, it's a good opportunity to start to practice how to soften into intensity with
Mm.
an amazing skill for labor.
I love that. This really spoke to me, people. Like when I had the couple of hours with Lo just recently, it really helped me to appreciate why in our very disconnected from our body world, we tend to judge our body externally about what the way it looks and how we're growing and our bellies and our bums and all this stuff that really doesn't matter. But we can be very critical of it. And yet it's doing one of the most magnificent things a human body will ever do is to conceive, grow, and birth a baby. And the changes that it goes through are quite extraordinary, and they hold a very, very deep, deep intelligence that we can overlook in birth. And what you're talking about here, Lo, is just the ability to connect in with that, intelligence, and to create a certain comfort around those uncomfortable feelings, but giving the body the opportunity to soften and create space for baby to descend through and potentially, hopefully, not get into tricky positions which can make it harder for the mother.
Yeah, well, we often don't know what vulnerabilities we have.
Yeah, of
We
course.
don't know what we're carrying in there. We
Yeah.
often don't really even have tools for that inner exploration yet.
Mm.
And so, my teacher Fiona talks about it as maximizing your anatomical potential.
Yeah.
And I think about it like, why leave it up to chance? You have
Yeah.
the opportunity to really discover a lot about what
Mm.
you carry, an individual carries in that space,
Yeah.
and start to build the toolkit for really, yeah, learn
Mm.
how to soften and working with the laboring process ultimately.
Yeah.
Because a lot of people find that they've learned a lot. They've learned a lot intellectually about the stages
Mm.
of labor and the tools that they're going to use.
Yeah.
And you get into labor, and all of a sudden, you're having this very embodied experience
Mm.
that no one ever really prepared you for. And you don't, it's tricky then to use the knowledge that you have in your mind to stay present in the body with
Mm.
those kinds of experiences. So I find, yeah, that practice of learning how to soften into that and really understanding what's happening in the body can
Yeah.
be really helpful.
So this is a form of embodied preparation, isn't it?
It really is.
And
Yeah.
yet, if we don't start to tune in, we go into labor and we have people doing what's called vaginal examinations, which require a foreign hand from a person who we may or may not know that's gloved, going in to feel our cervix, which can, for some women, be very triggering. Vaginal examinations, by the way, are not a medical necessity. They're always a choice, just popping that little one in there. But to go into something like that for the first time, and if we're and of course what the way you talked about the entering into, being invited into a woman's body, that's not how vaginal examinations are done. There's no
Not
invitation to
usually.
say we need to check you.
Yeah.
um, this is a whole other level of connection with our bodies that I think is very powerful. Lo, can you tell us, how does this differ from perineal massage, which is one of the recommendations often given to women prior to birth to prepare those tissues for second stage and the baby coming out?
Mm. So it is. I've done a little bit of I've tried to do a bit of a deep dive into the history of perineal massage because I was wondering
Mm.
this myself. Where did this whole thing come from?
Yeah.
And it's really interesting. It was created in the 80s, 1986, by an obstetrician who was a few obstetricians, but Dr. Avery um, was trying to create a method for preparation that would decrease episiotomy rates
Right.
and also perineal tears.
Great intention.
Great intention. And interestingly, her original description of how she taught, and for that original study, which was a very small study, I think it was 75 women, um, is very much more aligned with what I teach now
Ah,
and is very much different than the way we teach perineal massage in the hospitals now. So the original intention, hers, and granted, I feel like this knowledge would have been intrinsic traditional midwifery knowledge previously as well, but this is where it shows up in the medical knowledge,
yeah,
was very much more about connection and neuromuscular softening, not stretching.
right.
And it was deeper in the pelvis. So it was a recommendation to go, 4 to 5 centimeters and massage the posterior vaginal wall. And
Which
to
is where low?
so it means rather than just staying on the perineal muscle right at the entrance,
Yeah,
going past the perineal muscle and into that sort of pelvic floor muscle area into the back.
right.
Um, and so that was sort of the original intention. And since then, it's been kind of watered down to now this procedure where you or your partner uh, put both thumbs into your vagina, which is, I don't know about you, but I don't know anybody that can reach both their thumbs into their vagina when they're pregnant at the same time. So that's kind of
Mm,
ridiculous. And then it's real focus on this muscle at the entrance and stretching to the point of discomfort and getting used to stretching
yeah.
and the feeling. And I wonder about that because I wonder how much, rather than building connection, it actually creates disassociation. It's like
Mm,
tolerating discomfort, especially if a partner is doing it.
yeah.
We're just getting more used to experiencing something being done to us that's uncomfortable and tolerating it. And
Mm,
really, when you experience the softening of a perineum with just a single gentle finger, you realize that you don't need to stretch the perineum. It doesn't require forced stretching to be more malleable. What it needs is softness and safety. And so the way that I think about it as well is that, realistically, the perineum is the last place that the baby gets to throughout the labor. So if
yeah.
the baby doesn't get to the perineum, it does not matter how much perineal massage you've done,
Mm,
realistically. And so, if you could do a process that's slightly deeper in the pelvis, that really builds that connection and works on more tissues in the perineum, and and has the potential to make a more easeful passage through the entire labor, through the entire pelvis, why wouldn't you do that instead?
yeah. That makes a lot of sense. So,
Yeah.
what you're saying here, this is a much more physiologically it's intelligent way of preparing the mother's body in that it goes a lot deeper and it's not just the entrance, it's more the deeper passage and the muscles, ligaments, tendons, fascia, all the different things that that contains, working at softening. Mm,
Yes.
not stretching, but softening. I love that.
Yeah, exactly. And when you put your thumb into your vagina and you're in that back kind of part of the pelvis and you've got your fingers on your butt cheek on the outside,
Yeah.
between your thumb and your butt cheek there, you've got so many layers. It's amazing.
Mm,
You've got skin, you've got multiple layers of fascia, you've got multiple layers of muscle, you've got ligaments. And so we use the analogy kneading the dough to prepare that space, to really
yeah.
get into those tissues and knead the tissues and really get familiar with what's in there and that sense of pressure and that feeling your fingers softening into that tissue, feeling if you can feel any resistance and what it's like to use your breath to really open and soften into there.
Mm.
Mhm.
So that internal pelvic release work is not only supporting the mother's body to soften and be ready to receive baby, it can help the baby as well. Tell us about how it can potentially support the descent of the baby by creating more space.
Well, babies will generally move away from tension.
Right.
So, again, you can't lie to a baby. They will find the space that's there. And so, if we want to support a baby to be able to move as they need to move, ultimately we want to create as much space and reduce tension as much as possible.
Mm,
We're never going to be symmetrical beings. That's just not the nature of our bodies. What we're aiming for is for our tissues to be as responsive as possible so that when there's pressure from that baby on those tissues, they can soften out of the way. And so, that starts abdominally. That starts with creating a lot of softness and space for babies to get into a comfortable position for labor. And as they're developing, so they're not just, rigidly stuck in one place. And
Mm.
then as they're spinning and they're spiraling their way through the pelvis, coming past the sit bones, coming past the ligaments, um, hopefully they're able to use the mother's tissue and the mother's body as they do to figure out which way to turn and in their kind of proprioception. And then as those tissues soften out of the way, they can come through. And of course, we never know. It's not a guarantee, right?
Mm.
There's so many other parts of labor. There's no guarantee this
Yeah.
is going to be an easeful birth or a pain-free birth or, anything
Yeah.
like short birth to do this work. But I think that it's a really amazing opportunity to at least become familiar with the vulnerabilities that you might have and how much preparation is needed,
Mm.
and yeah, maximize the potential for that ease. And ultimately, it's about creating less trauma for mothers and babies,
Yeah.
as they're coming out, both physically but also emotionally, and long labors and interventions and things
Mm.
like
Do you have any theories about posterior labors? They seem to be getting more common.
that.
I know that's a bit of a tough question for you to answer, but do you have any thoughts about that?
A posterior baby is moving away from tension, right? They're
Right.
finding the most space that's there. So, on one hand, you could say that posterior labors are, you know, not ideal,
Mm.
but it's possible that that baby is getting themselves out of a trickier situation,
Yeah.
even. Perhaps they're going posterior because they don't want to come down in a brow presentation. Um, on the other hand, I think that we do carry a lot of tension. We do carry a lot of tension in the front of the belly. And I
Mm.
see a lot of women who carry their babies ROP, so on the right side, posterior deflexed. And I'm not so concerned about a baby that's on the right or the left necessarily. It's really whether they're flexed or not. And I think that's another midwifery skill that we sort of lost, is the ability for midwives to tell whether a baby's got their head tilted back or their head tilted forward. And um, so flexion, I think, becomes a much more important conversation than posterior necessarily,
Yeah, right.
because a
That makes so
posterior
much
baby
sense.
will be deflexed, but they might be coming around in a way trying to flex their head. So where, if there's tension in the body, is there a place that we can release that tension so that they're more able to flex and get into that good position? But
Mm.
I don't know. It's just a theory.
Yeah.
It does have lasting impacts, though. We was chatting with a midwifery friend who's a lactation consultant, and we were just speculating about how interesting it is that a lot of babies have torticollis and have a one-sided preference when they're breastfeeding. And then you see
Mm.
how many women have babies that grow in one position. They have a lack of mobility in the uterus, might be tucked up on one side. And so again, you kind of look at these follow throughs. It's like, okay, was there tension there? Did the baby grow in one particular orientation, and then perhaps it was really difficult for them to tuck their head because they're not used to doing that in the uterus, and then they come out and they have that one-sided preference, which makes breastfeeding more difficult. And the flow on is potentially huge.
Mm. And I think you're highlighting there that when these sorts of things present, when we palpate the uterus and get a sense of baby's positions and things like that, they can all be little clues that give us an indication of what your baby is finding comfortable or not comfortable, where that space is, where that tension is.
Yeah.
So I think, the body communicates to us all the time, but often we don't listen. Lo, I know you give the people that you work with, I think, is it 5 key things that they can start to do to prepare in an embodied way? Do you want to talk
So
about those?
yeah, so we talk about. Uh, I usually recommend everyone do the forward leaning inversion from Spinning
Mhm.
Babies.
Yeah.
No one's heard, you have heard of that. Um, because that works specifically on ligaments that support the uterus.
Hmm.
And there's a lot of um, ways that the uterus can be in or out of balance. Again, the uterus is not a symmetrical being, but we're hoping that it will be in enough balance that it doesn't have a twist in it or anything that restricts the amount of space for babies to grow into. So the forward leaning inversion is a beautiful exercise to help balance the ligaments at the back of the uterus and make space there. So
Mm-hmm.
really love that one. I usually teach women a psoas release. So psoas muscle is one of the biggest muscles in our body, connects the spine to the top of the legs, and it really wraps very internally around and over the top of the pelvic space. And when the psoas is tight, it's actually meant to be kind of a soft sling over the top of the pelvis. But when it's tight, it can create restriction for babies to be able to rotate as they need to. And most people I meet have chronically tight psoas because we sit a lot. And,
Yeah,
you
yeah.
know, that posture. So we do work on gently reminding the psoas with um, a gentle exercise each day. I like birth prep. You can do them like 5 to 10 minutes a day.
Mm.
So forward leaning inversion, a psoas exercise that takes 1 minute. Um, we talk about the pelvic breathing, so how to really bring your breath into your pelvis and how to practice that as a tool.
Mm-hmm.
I love this partnered exercise of having a partner's hand right above the pubic bone and a hand on the sacrum, and really using those the pressure and the warmth of the hand as a trigger for learning how to breathe into that space. Because I find as well in labor, when women get overwhelmed, it can be a really beautiful containing feeling to have your partner come and put their hands on you right there and say, breathe into this space. Makes, soften into my hands. It's again trying to get women out of their minds and into an embodied place.
Mm.
So I teach that as a partnered exercise. And then I teach women kneading the dough, which is the daily internal work that they can do themselves. Um, and then, if I can, I always teach people jiggling because I absolutely love
Mm.
jiggling. And it's, connecting to the fascia of the body. It's exactly what it sounds like. A lot of people will have used reboso if you do spinning baby stuff or heard of using that. And that's similar, right? It's just jiggling
Yeah.
the body in different ways. And it's such a beautiful tool for labor as well to help babies shift and move, and
Mm.
for midwives to learn to be able to use the reboso and jiggling to help soften the tissues. Because um, it's not all about internal work as well, right? Like a lot of
Yeah.
it is about the whole body health. How can you speak to the not just the fascial system of the body, but the nervous system of the body?
Mm.
And jiggling is a really beautiful way that we talk to both the nervous system and the fascial system.
Absolutely brilliant. That's great. I hope you all took that in because Lo did some of this to me, and man, my body was feeling good. Tell us how this can support us postpartum.
So uh, it's actually really amazing and important work postpartum. I mean, the statistics around in our culture, 30 to 50%, actually, someone said maybe even higher for prolapse rates for women, and 60% of women will have incontinence in their lives. So if I find those statistics quite shocking. So I feel like
Yeah.
there's something we're not doing right in terms of pelvic health.
Mm.
And when you look at traditional midwifery care, and I don't know a lot about many different places, but the places that I've heard of and know about, um, they really take seriously the first month post birth
Yeah.
in terms of rest and recovery. And that has obviously physical, emotional, spiritual implications and support for the mother, and baby. But even just from a physiological perspective, post birth, the womb weighs a kilogram still, and all of the ligaments that support that womb are stretched to support a big pregnant uterus. And it takes quite a long time for those ligaments to start to shrink to
Mm.
be able to support the uterus as it needs it. So within that first month, it has like a very important protective effect on the uterus itself and the amount of support that the womb has as it's hanging out in the pelvic space. A lot of cultures will have bed rest, literally women lying down as much as possible for that month. And others will do body work daily for, when I was in Guatemala, the midwives there, they see women daily for the first 3 weeks to do womb alignment and belly binding. And many, many cultures use different forms of belly binding to support the womb. So I think part of this learning about the anatomy is really understanding how rest postpartum is not a luxury, it's a necessity in a
Mm.
lot of cases, and figuring out ways to provide that womb support even if one has to be running around after a toddler or going to
Yeah.
the grocery store and doing things like that. And all that aside, this work is really amazing for scars. Really important to think about scars. If it can be perineal scars, can be cesarean scars, um, but ultimately we want scar tissue to be mobile, right? We want it to be nice and strong, and we don't want it to have adhesions and be sticky because that can create pain. It create lack of mobility in the tissues. So this work at an appropriate time post birth, for cesarean scars, people can start doing their own scar massage um, as soon as it's comfortable to touch. And same with perineal massages around their scar tissue.
Mm.
Can be a really nice thing to just make sure that the scar tissue is feeling soft and malleable.
Mm.
Both those are really important.
Often we avoid those parts of our body that, whether it be tearing or a cesarean scar, and can be very scared of, you know, that part of our body and that wound. But you're really giving a great insight into the process of healing, and some loving touch could really support the healing in a
Mm.
in a beautiful way. And once again, reconnect us to the amazing job your body does in bringing these babies into the world. It's quite incredible how women's bodies are designed for this. But the thing that happens for us culturally is we're wanting to get our bodies back, and wanting to exercise much earlier, and some of the things that can happen is after birth you can be quite high and you think, oh, I've got all this energy, I'm good to go running, or I'm good to go for a walk, when in actual fact you can be putting a lot of pressure on those tissues and the tendons and things at a time when it's really trying to bring you back into a non-pregnant state, and helping that uterus to find its way into a lovely retracted place within your pelvis. So getting into exercise too quickly, getting into the world too quickly, you're working potentially against your body, not with it. So Lo's giving us some great insight into how to have true respect for the woman's body, particularly the pelvis, and particularly what it goes through. Yeah, I
Yeah,
love
we
that,
do have
Lo.
a tendency to to get our bodies back
Yeah,
as soon as possible, and even the recommendation, I think, to go for a walk. Physios often recommend a 10-minute walk in the first week and then increase that each
mm,
week. And
mm.
um, and that
What's
can be
that
too much.
based on?
I don't exactly know. I know
Yeah,
some of the newer research around diastasis recti, for example, talks about how the less we do, the better women heal, which is
yeah.
really interesting.
Because you're
Um,
putting downward pressure on those I mean,
yeah,
this prolapse thing. I
yeah.
remember a woman I worked with once, and she was a runner, loved running, and she just wanted to get back into her running straight after the birth, and I think it caused the prolapse that she had.
And a
And
lot
yet,
of those things don't show up until postmenopause. I mean, that's the
yeah,
other thing is,
right.
birth can create a lot of imbalance in the body. And again, we don't have the traditional um, techniques that really
Mm,
help to support holistic healing, like closing
yeah,
the bone ceremony or postpartum massage and abdominal massage. And so I think, women will go through a pregnancy, they'll feel fine, they'll recover, they might go through a second, they might have a bit more pain, hip pain, back pain, those are all signs of vulnerabilities. Maybe
yeah.
third pregnancy, it's all fine. And then you go through menopause, and
Mm,
then you get the prolapse, then you get the incontinence, all those things that we didn't address post birth
yeah.
can really, really come out. So it can be really valuable to get postpartum body work. And, you know,
Mm,
postpartum mamas are not really thinking about themselves for the most part. They're
no,
thinking
they're
about their
not.
babies. So taking the time get body work, to get abdominal massage or internal work, whatever feels right, can
Mm.
be so important and so healing for that process.
Tell us about belly binding.
So many different cultures have belly binding practices. Um, I learned one style in Guatemala. It's just a very simple. You use a long piece of fabric. They have 2.5 to 3 meter long piece of fabric,
Yeah,
kind of narrow, and you wrap it a couple times around the belly. Postpartum specifically, um, it's important to have it low down on the pelvis because what you're aiming for is to lift the uterus. So right
right.
above the pubic bone is where you want that, as opposed to say having a belly bind that covers up high in the uterus, to suck the belly in or something like that. You don't want to
Right,
put pressure down. And
right.
and in that same vein, I usually recommend that women don't baby wear for the first month.
Mm,
I'm a big advocate of baby wearing, but I think in that first month, carrying a baby tightly on the top of your abdomen really puts a lot of pressure down on the pelvic tissues.
yeah.
And so while the uterus is healing, to avoid baby wearing if possible.
Mm,
But yeah, that the belly binding can be a really beautiful way to support the uterus, and it's a tool that I use and I teach women like for all menstrual health because it's a wonderful thing to wear when you're have your period and you've got cramps, and it's very, very supportive. And it's also a beautiful way to learn how to soften the front of the body. Like we were talking about, we tend to
yeah.
suck in, and I
Tuck in our
think
bellies.
it's something about being held and hugged by a piece of
Mm,
fabric like that really allows you to soften into it, and it
mm.
can really transform how much space there is in the front of the body.
And feel supported.
Hmm.
Feeling of everything's supported. Yeah.
Yeah. Yeah.
Well, that was brilliant. I hope you have appreciated the deep wisdom, the deep body wisdom that Lo has shared with us today and renewed your respect in what your body is doing and how we can support it to be ready to welcome these babies through connection, reading, and identifying sensations within your body, learning to soften and lean into those sensations, to really support our bodies physiologically through a few little exercises and things that can support our pelvis, and to really have respect for what your body needs post birth as well. I love that we've brought that piece in as well. Lo, can you tell us how people can access internal release work? It's not very common, and how it is a little bit different to perhaps a women's health physio.
Hmm. So it is quite different from women's health physio.
Mm-hmm.
So the work that I do and sort of the modality I trained with Fiona, really it isn't about diagnosing. So
Right,
if you have a prolapse and you have prolapse symptoms, it's in conjunction with that. It's very complementary. So
right.
pelvic floor physio diagnosis, they will offer often exercises for support. They can fit people for pessaries. Um, they the internal work they do tends to be more diagnostic and also to determine if someone has a tight pelvic floor and things like that.
Mm-hmm.
The work that I do, I would say, is more about softening and tension release, and it's really more of that exploration. And I think really working with how to connect to, whether not just whether you're doing exercises right, but which kind is right for you, that kind of thing.
Yeah.
If you're doing strengthening or softening kind of exercises. Um, And usually with internal work, we'll spend quite some time inside the body, whereas pelvic floor physios are it's a bit shorter. They might do some trigger point release in the muscles, but they tend not to go deep on the ligaments and some of the deeper structures in the fascia.
Right.
So it is quite a different style of practice.
Mm.
Um, I know Fiona and Jenny and Andrea are doing many courses. They're training a lot of people around Australia right now. A lot of them are in Melbourne, but there's a
Yeah.
few of us in Canberra doing it. And I've got a clinic in North Lynham. offering internal work, 2-hour sessions. So they're really long, beautiful sessions with lots of time for talking and slowness and nervous system work.
Mm.
And I think so. Lauren and Ria are offering internal work at their osteo clinic in Canberra,
Fundamental
Fundamental Health.
health, yeah,
They're a
in
really
Canberra.
fantastic women's health,
Mm.
a really holistic clinic. They've got physio there as well and acupuncture, and it's
Mm.
awesome what they're doing. And then yeah,
So
there's
I
a
might
few other
include,
people trained, but I'm not sure how much work they're doing around.
yeah. So I might put a few links in
Great.
to the show notes where people can potentially follow this up, because I think it's a very worthwhile thing to do. And my darlings, we are worth it. We deserve a beautiful belly massage and
Yes,
whatever else comes on
so
the dinner
good.
plate. Yeah.
And this work, Tracy, is just so people know, is like really
Mm.
helpful for outside of pregnancy and postpartum too.
Yeah.
It's amazing for fertility, for example, because
Right.
sometimes it's about womb alignment, sometimes it's about
Mm.
hormonal flow. Can be a great complementary therapy to endometriosis,
Yeah.
for reducing pain and adhesions, for
Mm.
people having painful sex or painful periods. There's lots of different reasons for those things. So I think it's really important that women start thinking about their whole pelvic health throughout their life and building that
Mm.
connection so that they actually know when something doesn't feel right or when they actually need care for things. We often suffer in silence for a long time
Yeah.
before we seek support. So yeah.
That's beautiful. And we're also bringing in Lo's wisdom into the Transform Your Birth course, because I don't want my families to miss out on this valuable information as well. So, thank you all for listening. And once again, I hope we've delivered some wonderful, wonderful wisdom to help you prepare for these precious times. So, we will see you next time. Thanks for tuning in.